Good afternoon, class. My name is Stefan Camarado. This poster presentation is on human confidence in artificial intelligence and in themselves. This paper was published in the Journal of Computers and Human Behavior. Artificial intelligence has shown its promise in assisting human decision-making. However, humans' inappropriate decision to accept or reject suggestions from AI can lead to severe consequences in high-stakes AI-assisted decision-making scenarios. This research studies how two types of human confidence that affect trust, their confidence in AI and confidence in themselves, evolve and affect humans' decisions. A cognitive study and a quantitative model together examine how changing positive and negative experiences affect these confidences and ultimate decisions. Results show that human self-confidence, not their confidence in AI, directs the decision to accept or reject AI suggestions. Furthermore, this work finds that humans often misattribute blame to themselves and enter a vicious cycle of relying on poorly performing AI. Human AI teams are increasingly deployed to improve joint performance and accomplish tasks that neither an AI nor a human can solve alone. Humans often remain responsible for the final decisions due to ethical concerns. Therefore, these teams can only reach their collaborative potential when human decision makers appropriately accept or reject AI input. However, humans are prone to error. Their failure to discern when to accept or reject AI input hinders team performance. This is especially problematic in high-stakes situations where decisions affect human lives, such as self-driving cars and medical diagnosis. For example, in the 2015 Google car crash, the Google car was hit from behind when the driver manually applied the brakes while the car was slowing for a pedestrian. Although this crash only resulted in a mild whiplash, humans' inappropriate judgment can lead to more severe accidents. Not only this, the performance of Watson on oncology, which is IBM's cancer treatment recommendation system, varies greatly depending on the population and the type of cancer. If doctors fail to reject Watson's faulty recommendations, patients can receive inappropriate treatment for their cancer. Recent literature points to inappropriate trust as a reason for under or over relying on AI. According to recent surveys, 42% of participants lack general trust in AI, and 49% of participants could not name any AI product that they trust. Furthermore, humans are highly unforgiving of AI error, subsequently distrusting AI input regardless of its quality. There are three main research questions that the authors wanted to focus on. The first is, how do changes in AI performance and resulting positive and negative feedback affect human confidence in AI and human self-confidence? The second is, how are those two types of confidence associated with the probability of accepting AI suggestions? And the final is, what decision-making pattern distinguishes those who successfully accept and reject AI suggestions? For the author's research method, participants are given a chess puzzle task in which they, in collaboration with an AI, must make the best chess move given a chessboard state, which can be seen in the top image above the graphs below. This task enables a wide range of possible decision choices and the unpredictability of the outcome resulting from the current decision, representing many decision-making scenarios in the real world. 100 participants were recruited and completed the experiment. All participants are fluent English speakers and know how to play chess prior to their participation. There are two experimental condition groups, the positive and negative AI performance change groups. Participants are randomly assigned to these groups, 50 in each group. The two conditions both include two AI performance levels, 80% and 20% accuracy, with the participants experiencing the two levels in opposite orders. In condition 1, AI performance changes from 80 to 20% accuracy, while in condition 2, it changes from 20% to 80% accuracy. The chess puzzles in the study are chosen by considering the difficulty and possible next moves. Following 3 practice chess puzzles, participants in both conditions solve 30 puzzles to capture repetitive collaboration scenarios and allow for an examination of how individual experience impacts human confidence in AI and in themselves. After the first 20 puzzles, the AI performance level changes, instantiating the dynamic performance of the AI. First, the participants are asked to select their best move without the AI suggestion. This is to collect data about the individual chess skill level without the AI's help. Once the participants make the unassisted selection, they receive the AI suggestion and are asked to make the final decision to accept or override it. Here, the study is designed so that when overriding the AI suggestion, the participants are not limited to their unassisted selection, but can make any move different from the AI suggestion. The participants are asked to report their confidence in their own ability and the AI's ability in solving chess puzzles in the 5-point Likert scale. For the results, focusing on condition group 1, graph A in the bottom left shows that when initially interacting with the AI from puzzles 1 to 20, good AI performance does not significantly affect the human confidence in the AI, while poor performance decreases it. After the switching in the AI performance after puzzle 20, the trend in the confidence in the AI, which is that dark blue line you see, alters significantly in both conditions in the same direction as the AI performance change. Graph C on the bottom right demonstrates that when initially interacting with the AI from puzzles 1 to 20, both conditions do not show a significant impact on self-confidence. When the AI changes to perform worse, self-confidence shows a decreasing trend. Yet, when the AI changes for the better in condition 2, self-confidence is not affected significantly. Therefore, the participant's self-confidence changes significantly only when an initially good performing AI starts to perform badly. In conclusion, the results of this work indicate a human tendency to misattribute the blame for poor AI performance to themselves, a significant impact of human self-confidence on their decisions to accept or reject AI suggestions, and a resulting vicious cycle that hinders effective human AI decision-making. This research shows that poor AI performance decreases human self-confidence, which is found to influence the decisions to accept or reject AI suggestions. This work has some limitations that offer opportunities for future research. First, the study focuses specifically on the chess puzzle task. Extending the study to different human AI problem-solving applications will indicate whether human confidence and its effect on adoption of AI advice differ in higher stakes situations. Finally, this work focuses on two types of human confidence that affect trust: confidence in AI and self-confidence. For a comprehensive understanding of how trust affects AI-assisted decision-making, other factors of trust such as personality and environment can be explored. This concludes my presentation. Thank you.